So hello everyone, good morning and welcome to the National Hispanic Council on Aging webinar on social isolation and loneliness among older adults. My name is Christine Perez. I'm the Director of Programs at the National Hispanic Council on Aging, or NHCOA for short, and it's my pleasure to be moderating today's virtual event, which is supported by the Administration of Community Living, also known as ACL. So for over 50 years, the National Hispanic Council on Aging has worked to improve the lives of Hispanic older adults, their families, and caregivers. Our commitment to our mission has only been emboldened in the face of ongoing health disparities that continue in our communities. So as we commemorate Mental Health Awareness Month, this webinar is an opportunity to discuss the digital divide as it pertains to the older adult population, and also the benefits in enabling older adults to make better use of technology to combat their social isolation. So today's webinar will also feature a testimonial with experiencing serious impact and also the implications of social isolation. So following our agenda, we will be discussing strategies to better address this neglected issue. So to begin this virtual event, it's my pleasure to introduce Dr. Yanira Cruz. She's the President and CEO of the National Hispanic Council on Aging, and she's also one of the nation's foremost advocates and spokesperson for diverse older adults, and has been recognized also for her commitment and leadership on behalf of diverse seniors nationwide. So welcome, Dr. Cruz.
Thank you, Christine, for your warm welcome, and also welcome and thank you all to the panelists for being here. Manuel, thank you for joining us. Ana, thank you for being here, and Rosa, thank you for joining us. I think together we're stronger, and I think our community can really benefit from this important information that we will share this morning. So thank you, Christine, for moderating and for your wisdom in bringing us together to speak about this very important issue, social isolation. I think, it's one of those public health issues that we often don't talk about. I mean, it sort of happens and it sort of moves in to our lives and into our homes, the social isolation, and we kind of get used to that, right, that pattern, but slowly it penetrates and it really infuses into our lives, creating many challenges in our health, and so I'm glad today we're pausing and really paying attention to this so important issue that we have to deal with. And I know we will hear more about the housing facility that the National Hispanic Council on Aging owns and operates. We will hear more of the experiences that we're living there, that we are doing there. But firsthand, I can tell you that at Casa Iris, we are able to interact with older adults on a daily basis, and we are able to see how this connection among themselves and the connection with activities that keep them engaged and active makes such a big difference. I remember when we brought into the housing facility physical activity, and prior to the physical activity, it was Casa Iris, and people were, there sort of walking and doing their thing. But nothing, you could see that people were not fully engaged, not fully their best selves, right? And then, we arranged for physical activity classes to take place at the housing facility. And boy, what a difference that made. You started to see the energy and the joy and their health started to improve. folks who were diabetics were beginning to feel better, and just you could see these smiles in their faces. So we have been able to see that firsthand at the National Hispanic Council on Aging. So, I think this is such an important topic that touches so many other health aspects in a person's life. So today, as Christine mentioned, is Mental Health Month, Mental Health Awareness Month, and it's a great way to commemorate this month. And I think the Administration of Community Living, also known as ACL, who is partnering with us on this program, has declared Older Americans Month's theme to be Powered by Connection, in order to emphasize the incredible impact that strong connections with others can have on an older's health. Specifically, maintaining strong connections with our loved ones and community can have a profound impact on the longevity and general health of older adults, as it deters feelings of loneliness and social isolation. And I think we will hear more from our experts, but I think there's some important ways that we can do and carry out to avoid isolation, social isolation, and loneliness. For example, staying connected through phone calls, through video calls. Now that technology allows us to have greater connectivity to friends and family. And I know for Latinos, familia is such an important piece of who we are, right? So holding on to that and making sure we stay connected is important. There's also ways to engage through online classes or in-person classes that can also help with this aspect. An example that I just gave is the physical activity classes that we have at our housing facility, which I have seen how tremendous they are and how helpful they can be for the overall well-being of an older adult. So that's another strategy to address social isolation and stay engaged. Activities that are connected to faith-based organizations, whatever your faith might be, church, synagogue, whatever it may be, that is also a place where one can get connected and stay engaged. And then, just outside physical activity, walking is it's great. I know I try and walk, or I love to run. So when I can, I go for a run. But if not, a walk around the neighborhood is just, it takes an important role in a person's life. So I encourage you to do that, and of course to eat healthy, right? Watch what you eat, eat vegetables and hydrate yourself, especially every day, but especially during the summer when it's very hot. It's important to stay hydrated. So our experts will give us more tips, and of course all this, in order to stay connected, I think these days we have to have access to technology. So I know our friend and colleague Rosa Mendoza will be giving us some additional tips on how to use technology to stay connected, and probably Manuel will also give us some tips in this arena. So again, muchísimas gracias por estar aquí. Bienvenidos nuevamente. Gracias, Christine, for holding this webinar, and please enjoy the rest of the program.
Thank you, Dr. Cruz. So let's start with our panel session. And in recent years, and especially since the COVID-19 pandemic began, social isolation and loneliness have become prevalent across the US. We have become far more educated and aware of the dangers of sickness and how isolation and social distancing can keep us safe, right, from severe illness. And make no mistake, it is good that we're taking precautions for our health, like isolating when need to be. But we also have to remember that these precautions doesn't necessarily stop with our physical health, but must include our mental health as well. So let's welcome our first speaker, Mr. Manuel Acevedo, who is the founder and CEO of helpfulvillage.com, a tech company that helps older adults to stay aged in their own homes by fostering relationships and with their neighbors. So he's also an adjunct lecturer at the University of Southern California from Leonard's Davis School of Gerontology. So today, Mr. Acevedo will highlight the key principles for older adults to better thrive and avoid isolation. So welcome, Mr. Acevedo.
Perfect. Thank you. I hope everyone can help me, can hear me. Thank you, NHCOA, for the opportunity to present today. I'm going to get straight into it, but it's a pleasure for me to be here presenting at this webinar. So we go to the next slide. I'm going to start introducing myself, and this is it. Hola, soy Manuel, and I'm going to give you a little bit of my background. Tag. So basically, I was born here in the Canary Islands, Spain, a little bit in these islands in the Atlantic Ocean, and then I moved to Switzerland, where I did this very prestigious engineering school, one of the best engineering schools in Europe, and then moved to the US. So this is basically the school I did. I worked for the state of Geneva, which is interesting, and then finally moved to Silicon Valley. I actually had my first startup in Europe, and our American competitors, they raised $200 million with a similar product. So I thought, what am I doing in the wrong place? I need to go and move to the US, and that's what I did. And I created a new company, a new startup that is called Helpful Village. This new company that I created, oh, I forgot this one because I have a fun fact. I was born in the Canary Islands, Spain, but my grandpa was born in Cuba. So I went one step back in my loop. So that's maybe where you can find a little bit of my accent, a mix of Spain and Cuba, next. So basically, the startup that I created is called Helpful Village, and I came out of the startup accelerator of the University of California, Berkeley. So I'm very thankful for their support in launching this company, Tech. After getting out of the university, we received all the awards in aging. So Aging 2.0 Top 10 Innovator in the fight against social isolation in 2020 during the pandemic. Next. And then a fellowship from the American Society on Aging. We are a startup from the HTech Collaborative from AARP, TAC. And the last one piece is that I'm also teaching Aging in Place at the University of Southern California School of Gerontology. So that's about my introduction, but I want to introduce you another person next. And the next person I want to introduce you is my mom. So these are a few pictures of her, and this is what she did. Her professional activity was taking care of our family vineyards that you see on the right. So we produced essentially grapes, and we did a little bit of wine too, and that was wonderful. Indeed, was our own land. Next, until one day she got knee surgery, and with that knee surgery, obviously her professional activity became very difficult. Maybe impossible. Next. And so basically it was time to have a mother-son conversation where basically I'm raising these questions. Mom, is it time to retire? And my mom would say no. Next. Because she said, I don't want to be at home doing nothing. And she was right, actually. Wait, slow, ooh-la. And basically it's interesting because basically doing nothing was worse than basically having swollen knees and pain in her knees. So she got a point there. She was right and I was wrong. Whoops, the slides are moving by themselves, not me, I'm sorry. Second thing she said is, son, promise me you're not sending me to a nursing home, which was surprising to me because she was 63, she got knee surgery, but she was in perfect health. All I was saying is like, Mom, you just cannot be walking for 8 hours a day on uneven fields. So it just, who's talking about a nursing home? But here again, she was right and I was wrong because her question was not about the present day, but it was about what's going to happen down the road as she needs more assistance. And basically, as we were discussing, right, about what she would need to do to age in place, I added one more point, which is saying, well, mom, okay, fine. I understand you want to age in your own home, but this is something you cannot do alone. Not okay if you're alone at home by yourself. You need a little bit of support. And basically, through this discussion with my mom, we raised the three most important questions in aging, which is purpose, as you can see on the top. Oops. And then next, the second question, which is autonomy, and the third question, which is social connection. So with these three concepts, you can age happily, in my opinion, because those are the three most important things you can do as you age. Next. And then basically I brought the point about social connections because we are social animals. If you look at the picture on the bottom left, basically as cavemen, we were all in a unit. The young people were with the older folks, and we would help each other just for survival. That's how we work. That's what is in our DNA for millions of years. Now, next. What is interesting is that very recently, I mean, I told you I was born in the Canary Islands. That's where my mom lives. And now I live tens of thousands of miles away. So basically, this unit, right, and social structure that existed before, obviously the family, is challenged now, and we have new problems that have emerged. But this new problem has emerged only in the last 100 years, where basically kids have left home in big numbers because they go to seek work in other places, and suddenly we left our older adults alone. If we go to the next slide, next picture. This translates into an epidemic of loneliness, right? A person like my mom, but many other people, and we have statistics about this, are feeling lonely and depressed because they don't have their crew, their group of people they can talk to and interact with. Next. So my whole job right now is basically recreating a new social structure. And sometimes when the kids are not there, next, we cannot necessarily, if the family is around, it is great, but if they are not around, we need to make sure we build these communities of older adults that support each other. And this is now possible today because with the technology and the modern way of life, we can connect with other older adults and basically build a new social structure that will be so vital for our lives. Next. Now, the question is, how do we build social connection? And basically, it's easy to say, okay, yeah, it's great to go out and connect with other people. How do we do it? In my opinion, the way to achieve it is that you need to get together with other people that want to achieve the same goals. And the same goals that are very common at this age, oops, if we can go back, are the same three goals that my mom mentioned before. It's having a sense of purpose. What am I gonna do when I wake up? How do I feel appreciated by my community? How can I do something useful? The sense of autonomy, how do I keep my independence and autonomy to live wherever I want to live in the way I want to live? And the third point, that was social connection. So now that we have a group of older adults in a local community that want to build this social connection, that have the same goals, the next step is basically forming this actually social structure that exists already, that I did not invent, that is called a village. Sometimes it's called a healthy aging village or a age-friendly village. Is a concept that was invented in Boston 20 years ago. When my mom threw me a challenge about, her purpose and stuff like that, I did not have the answer. I did some research and I found this concept that existed before. And a village is essentially, the definition of a village is just a group of older adults that care about each other. And this is exactly what my mom wanted. But basically what's interesting is that because my mom is helping other older adults that want to age in their own homes, she's being purposeful because she has meaning, she's being appreciated, and she's being a productive member of her local community. And at the same time, these other people in return, they help her age in her own home. So basically she's achieving autonomy also because she can live in her own home with a little bit of help from her neighbors. So basically this concept of just neighbors helping neighbors is solving the three challenges that we discussed before. Next. Now, what do villages do? Well, basically villages are these associations of older adults that get together, and they organize these little things. They organize these events, yoga classes, coffee, walking groups, and other opportunities for older adults to get together. They also organize services. My mom cannot go to the doctor on her own. She gets stressed out, and she starts freaking out, and then she just cannot do it. But if she can put in a request to her group to see if there is a volunteer that can come to her doctor appointment with her, then it's a lot easier for her. Next. So basically these are just volunteer services. So basically we have villages that organize in-person and virtual events, and also that coordinate volunteer activities, either, services through volunteers, and when a volunteer is not available, maybe a recommended vendor that is trusted in the community. Next. More sophisticated villages, they also do these things. They have check-in programs where basically they call, my mom can call another member is calling another member, so they were checking in on the phone with each other. We have villages that are doing emergency preparedness. Recently in Houston, there was a tornado, and basically the village, what they do is that they contact all the older adults in the community, in the village, and they ask how are they doing. If they're okay, then it's fine. If they're not okay, maybe we can send a volunteer to knock on their doors and see what's going on. Next. And the last piece is that a lot of the members of these villages have interactions with the healthcare system. We have a beautiful village in Sausalito, California, and they have a group of retired nurses, and these retired nurses are calling the members regularly, maybe every 2 other weeks, to see how are they doing with their medications and their conditions, etc. But you see here the power of the group. If we're just as social animals, we're just gonna help each other doing all these things together. Next. Okay, so basically villages are today the largest and the most celebrated aging in place model. So this model exists already. As you can see here, there are several New York Times articles about it, and it's very well known, but now it's gonna grow even more. I'm gonna explain you why. Next. Basically because it's getting all over the place. It's the largest, and each one of these dots is a village that exists today. Today we have more villages in the East Coast than the West Coast. If we go next. And villages are serving today a community of 40,000 older adults that are members of these villages across the country. In 270 villages that are already established, and then the number of villages is growing across the country. Next. These are just a couple of examples. Avenidas Village in Palo Alto, California, a mile away from Stanford, at the heart of Silicon Valley, is doing this from the Senior Center. We have Beacon Hill Village in Boston, which started the village movement. And in a city like Washington, D.C., inside the district, there are already 14 villages. So 14 neighborhood groups that are supporting older adults. Next. I wanted to show you a little bit of the technology. It's just a few print screens, but basically technology plays a key role in running these villages. Because basically, if you want to run the whole thing with paper and spreadsheet files, it's really hard to connect with other older adults. But if you use a tiny bit of technology that is super easy to use, it's easy to post a volunteer service request and for somebody else to pick it up and make an appointment to meet to help this member. Next. And this makes the whole difference. Villages have existed before, right? Neighbors helping neighbors. But if we do it in a manual way with just these phone calls, it's a labor-intensive operation that needs staff that would be expensive. So what is new right now, and what is changing everything is what's coming in the next slide, is that if we use technology, we can structure all these efforts and streamline the village operations with a list of providers, with a list of volunteer opportunities, connecting Zoom, connecting the check-ins for the email reminders. And basically technology transforms the model into a cost-effective and scalable model. So basically there is no aging program that can exist that is more cost-effective, cheaper than this one. If you're a smart city, you want to put money into this because basically there's just a server running somewhere that costs very little. And essentially all the work is being put in by volunteers like my mom that are not being paid, and they're just happy to help each other. So nothing, there is no other aging program that is cheaper than this one. Next. And that's why basically villages are adopting villages. Cities are adopting villages. As you can see, these are a few examples of Washington, D.C., that has 14 villages. In the center, you have Palo Alto, California, with several neighborhoods, Columbus, Ohio, and the last one is Portland. So basically, just villages is coming into age-friendly planning across the country. Next. That is my last slide. So basically, my last invitation is to invite everybody to get out of the house and find your people. Because even if technology is great, the solution against social isolation is people. So technology can help, but basically get out of the house, find your people, and you'll be happier. I want to thank everybody for your attention. And then I'm giving you here my email address. So it's acevedom@usc.edu if you want to continue this conversation. Thank you.
Thank you, Mr. Acevedo, for this wonderful presentation. So at the end of the panel session, we will have a question and answer session where all of you can further discuss Mr. Acevedo's expertise. And until then, please feel free to write your questions in the chat box. And let's continue with our next presenter. So loneliness and social isolation in older adults are serious public health risks affecting a significant number of people in the United States, putting them at risk for dementia and other serious medical conditions. So it's a fact that social connection and the integration of technology is critical for individuals and communities' health. But let's hear more about this topic with Rosa Mendoza, the founder, president, and CEO of Avanza. It is her vision, personal and professional experience, and also knowledge of underserved communities that led to the creation of the organization. And she also set the tone for its critical mission of ensuring that Latinos and other underserved communities have an equal opportunity for success in our technology-driven world. So today, Ms. Mendoza will speak about why technology is important to address isolation. So welcome, Ms. Mendoza.
Thank you, Christine. Good morning, everyone. As mentioned, my name is Rosa Mendoza, and I'm the founder, president, and CEO of Avanza. Avanza is a nonpartisan, forward-thinking policy and action nonprofit organization that advocates for success of Latinos and other underserved communities in our innovation and technology-based society. We fully understand how technology and innovation have become essential for progress in every aspect of our lives, including education, media, commerce, communication, health, entertainment, and transportation. We work to ensure that Latinos and other underserved communities are protected against the negative impacts from policy and technological developments, and most importantly, that they are well positioned to take full advantage of the many opportunities provided by continued innovation. Thank you, Dr. Cruz and the National Hispanic Council on Aging for including me in this important conversation and for the wonderful work that you do to help older adults. As we all know, in today's increasingly digital world, the concept of the digital divide highlights significant disparities in access to technology. This divide is mainly pronounced among the older adult population. Who often face unique challenges in adopting and utilizing digital tools. Understanding and addressing these challenges is absolutely crucial, not only to ensure equitable access to technology, but also to combat the social isolation that many older adults experience. By empowering older adults with the skills and resources to effectively use technology, we can enhance their social connections, improve their health and well-being, and promote a more inclusive society. This conversation will explore the specific barriers that older adults face in the digital realm and the profound benefits that come from using technology to address social isolation, and also the importance of closing the digital divide. Excuse me, I'm now going to mention a list of some of the benefits of enabling technology use among older adults. Technology can help with combating social isolation in the following ways. Enhanced communication. Obviously, the easy access to video calls, social media, and messaging platforms to stay in touch with loved ones is essential for the older adult population. Community engagement, such as participation in online communities, interest groups, and social networks can also help older adults. Improved health and well-being. Access to telehealth is essential for older adults, for example. Obviously, we see convenient virtual consultations with healthcare providers and how much that benefits older adults. Technology can help adults to check their health. For example, they can use wearable devices and health apps to monitor and manage health conditions. Mental stimulation. Cognitive benefits from engaging in online games, educational courses, and other brain-stimulating activities. Increased independence and safety. Smart home technologies, devices that can enhance home safety like smart sensors, emergency alert systems, and systems like that are obviously greatly benefit older adults. Online services like access to groceries, medications, and other necessities through online shopping and delivery services are obviously essential for older adults. Enhanced lifelong learning and personal growth. Online education, like opportunities to learn new skills and taking courses on relevant issues. Digital literacy programs like community programs aim at improving digital skills and confidence in using technology. Economic benefits include employment opportunities, such as access to job listings, remote work, and freelance opportunities. Financial management, like using online banking, investment tools and financial resources to manage finances more effectively. Technology and innovation clearly offer a lot of benefits for older adults. However, if we don't close the digital divide, for older adults will not be able to take advantage of these many benefits that technology and innovation can offer. So let's talk about the digital divide and older adults. But first, I'm going to explain exactly what the digital divide is for those who may not be very familiar with the term. The digital divide is the gap between individuals who have access to modern information and communication technology and those who do not. And unfortunately, older adults are on the wrong side of the digital divide. And again, this includes disparities in access to devices, internet connectivity, and digital literacy. So the factors that contribute to the digital divide among older adults include the following: economic barriers, so limited to income to afford devices and internet services; educational barriers, so lower levels of digital literacy and comfort with technology; physical barriers, which include age-related challenges such as vision or dexterity issues that make using technology more difficult; psychological barriers, fear or mistrust of technology and perceived lack of need; reduced social isolation, so reduced ability to stay connected with family and friends, obviously; health disparities, limited access to telehealth and online health resources; economic disadvantages, missing out on online banking, shopping, and services, as I mentioned earlier; and information gap, difficulty accessing information on current events, services, and opportunities. So clearly, based on some of the things I mentioned, how technology helps older adults, it's clear that we need to close the digital divide. It's clear that we need to ensure that all Americans, all Latino communities are connected to technology. But we need to close the digital divide in order for older adults to ensure, in order for them to be able to use this access, right, and gain benefit from this. So I'm going to focus now on some strategies to bridge that digital divide. So we need to have education and training, offering digital literacy courses that are tailored to older adults. We need to provide one-on-one tech support and mentoring, because we have to remember that older adults are not digital natives, right? So they need more help in ensuring that they can be able to access technology and fully understand how to navigate this world that can be very challenging for most people, actually, but especially for those that are not digital natives. Ensuring that adults can have affordable access, for example, educating older adults on programs to subsidize the cost of devices and internet services for low-income seniors. The FCC's Affordable Connectivity Program is the program that can help, but obviously the program is going through changes at the moment, and they are trying to continue to get the program funded, which I'm hoping they will, and that's one of the main things that we advocate for, to ensure the programs like the ACP are funded so that those programs can help people that need to have affordable internet. Partnerships with tech companies to provide affordable or donated devices. Those partnerships are extremely important. Ensuring we have user-friendly technology. For example, developing and promoting age-friendly technology with simple interfaces and accessibility features. Encouraging technology developers to consider the needs of older adults in their design processes. It's extremely important that we have, again, user-friendly technology because, as I mentioned, older adults are not digital natives. I'm a mother, I have a 6-year-old, and in 2 seconds, he learned how to use an iPhone and an iPad because he's a digital native, right? But older adults, they're not digital natives, so they have more of a fear of technology, and they don't have the skills they need to be able to use it. So it's extremely important that new innovation, it caters to older adults as well. And finally, community support and outreach. For example, engaging community centers, libraries, and senior centers, organizations and centers in technology training and support efforts. Creating intergenerational programs is very important, where young adults and young individuals can help teach and support older adults in using technology. As I mentioned, the benefits provided by innovation and technology are amazing. At this point, we can do very little without technology, right? Because technology has impacted every single aspect of our lives. As I mentioned, the way we communicate has been impacted, the way we work, the way we, do business, everything has been impacted by technology and innovation. But we still live in a country that has a very stubborn digital divide. And if we don't close the digital divide, many communities, including the older adults community, is going to be left on the wrong side of the digital divide, and they're not going to be able to take advantage of the wonderful benefits provided by technology and innovation. And that's the end of my presentation, Christine.
Yes, thank you again, Ms. Mendoza. So once again, please feel free to write your questions in the chat box until our question and answer session will begin at the end of today's webinar, but we still have another speaker left. And a report from the National Academies of Sciences, Engineering, and Medicine points out that more than 1/3 of adults aged 45 and older feel lonely, and nearly 1/4 of adults aged 65 years and older are considered to be socially isolated. Older adults are at an increased risk for loneliness and social isolation because they're more likely to face factors such as living alone, the loss of a family or friends, chronic illness, and also hearing loss. However, we can all make a difference to tackle this challenge. So our next speaker is Ana Guzman. She is NHCOA's mental health specialist who will be providing an overview of strategies to address social isolation among older adults. Welcome, Ana.
Thank you, Christine, for the introduction. And hello, everyone. As Christine already said, my name is Ana Guzman. And on this occasion, I have the honor to talk about what we can do to address social isolation. And I would like to emphasize that we will not only talk about strategies to address it to third persons, but also to prevent it in our personal lives, because aging is an active process which takes place from the moment we are born. So all of us here have to collect these strategies to try to make this process as successful as possible, and also to take care of those around us. So let's begin. Next slide, please. I like to start with basic terms. I would like to separate what is social isolation versus what is loneliness. And as we can see, loneliness is the feeling of being alone, regardless of the amount of social contact. And in the other way, social isolation is a lack of social connection. Of course, one of these two leads us to another, because social isolation can lead us to loneliness in some people, while others can feel lonely without being socially isolated. But that is another issue within mental health and not for this time. Next slide, please. A report from the National Academies of Science, Engineers, and Medicine point out that more than 1/3 of adults age 45 and older feel lonely, and nearly 1/4 of adults age 65 and older are considered to be socially isolated. So yeah, older adults are an at-risk population for loneliness and social isolation, because, as Christine already said, they are more likely to face factors such as living alone, the loss of their family, even hearing loss, which is also affects the desire or motivation many people have to interact outside their homes. Next slide, please. Okay, to know how to treat social isolation, we also need to first identify what caused it. And even though I already mentioned some factors such as living alone, losing family and friends, and hearing loss, there are also other factors such as the following. The first one is low self-esteem and depression. The feeling of not being enough, along with low moods, cause people to isolate themselves and seek the comfort of home, and loneliness to avoid feeling worse about themselves. And also, depression is a clear source of discouragement and loss of pleasure in activities that used to be enjoyed. The second one is dementia. Any type of dementia due the loss of cognitive abilities can limit social interaction in people who suffer it. Next, please. Being a caregiver, and this is important because caregivers of all ages are also likely to become socially isolated. Full-time caregivers may be at a risk of losing social connections with friends or with other family members. And the last one is language barriers. And this is a factor that affects many migrants, whether Latino or people from other races or ethnicities who lives in the United States, sorry, and have no knowledge of the language. Having this barrier to explicit communication is a clear limitation for people to interact outside their home. So now, what can we do to avoid and address social isolation? Next, please. It seems simple to say that we just do not have to fall into the causes I mentioned before, but in fact, there are also strategies we can put in practice to address this issue. And the first one is stay connected or keep in touch with our loved ones. This may include scheduling daily phones and video calls to catch up, and making person visit if is possible, and maintain communication through social media and text messaging. The second one is physical activities. Taking short daily walks and getting fresh air helps to have contact with nature and remain active with our environment. Joining a yoga group or outdoors physical activity is also an example. And physical activity also brings benefits to our physical appearance. And if we feel good about ourselves, we will also feel good about interacting and sharing with others. Next, please. And the third one is find and practice a hobby. It can be a new hobby or something we have always enjoyed doing. And it is never too late to learn something new. It can be painting, music, crochet, even learning a language, or joining reading groups or spiritual groups also helps. And of course, if it is a hobby that can be done in the company of more people, it is ideal. And the last one I want to talk about is look for professional help. I always like to point out this recommendation because many times we see professional help as a last resort and not as a way to prevention. And talking to a physical or mental health professional is very helpful to know how to go through the changes in aging, and that changes that may lead us to feel insecure and embrace this process to fully take advantage of it. Okay, all of these strategies are very practical, and including them in our routine makes a big difference. Now, in the following sorry. In the following slides, I will like to share with you the work that we as NHCOA are doing to help older adults address this social isolation. The next one, please. The first strategy that we are putting in practice is the physical activity sessions. 3 times a week, the older adults gather in the community room of Casa Iris, a housing facility in Washington, D.C., to do physical exercise appropriate to their capability, to bring no, sorry. This brings many health benefits. They enjoy doing it, and most of all, it creates bonds with each other. And sometimes they also play games that encourage teamwork. The next one, please. The next one is mental health talks and art therapy. This activity is very helpful for older adults to interact with others while they learn about mental health, self-care, and some of the problems they may experience in the aging process. And art therapy is also a way to express emotions and thoughts of all kinds. Also, this activity is held in a safe place. In a safe space, sorry, where all participants contribute and help each other and avoid prejudice. I am the professional who guides this activity in Casa Iris, and many of the comments about it are positive. For example, Elia is one who never skips a meeting and always mentioned that talking and getting together help her to not to be locked up at home thinking about her worries. And Enrique, another older adult, also comments that the art therapy makes him blur bad thoughts and also allow him to attract positive thoughts. The next one, please. The beauty sessions, we have beauty sessions in Casa Iris. Older adults can go twice a week to the community room where a volunteer is available to give them haircuts and care to their fingers and toenails. In this way, they can feel good by looking good. The next one, please. Recreational trips. At times, the older adults have had excursions where they have been able to go out as a group to visit, as an example, the National Harbor in Maryland, and also have camp days. And the last one, it's celebration parties and gatherings. At Casa Iris, we do not miss the opportunity to celebrate events such as Older Americans Month, Mother's Day, Father's Day, Hispanic Heritage Month, birthdays, etc. And it is a space for sharing where all residents can recreate and interact under the same purpose, that is to celebrate together. All the activities are enjoyed by the older adults. They always end up grateful, wishing that it will be repeated and that more of the residents who perhaps could not attend will attend the next time. So with that, I conclude my presentation and and I want to thank you for all your attention. And as a part of the NHCOA team, of course, I am proud of the work we do. We hope to have more accomplishment to show and to serve as an inspiration for others. Thank you.
Thank you so much, Anna, for your presentation. So before we continue with the question and answer session, again, there's still time for you to send us your questions. Feel free to type the questions in the chat box. But before, now we have a pre-recorded video testimonial from Mario Franco. He's the coordinator for our senior housing facility at Washington, D.C., which name is Casa Iris. And today he will share the importance of engaging seniors with physical activities and mental health charlas or educational sessions. He will also be highlighting the impact of outreach for seniors.
Mi nombre es Mario Franco y trabajo en Casa Iris apoyando a los adultos mayores para que ellos puedan permanecer aquí de manera feliz, tranquila y saludable, haciendo diferentes actividades. Contamos con varias actividades. En primer lugar, tenemos una sección de ejercicio que se da lunes, miércoles y viernes. Y esto les ayuda mucho también a mantenerse activos, saludables y les ayuda a bajar de peso, les ayuda a que se mantengan con menos enfermedades. Y una de las cosas que he notado yo es que les ayuda mucho a la movilidad, ¿verdad? Porque algunos han padecido de problemas en las rodillas, en las articulaciones, y en la medida que ellos se integran al ejercicio, entonces van desarrollando más. Hay cortes de cabello, les arreglan los ojos, les quitan las uñas, les hacen el pedicure, el manicure y bueno, todo es gratis y eso les eleva el estado de ánimo a la gente porque ellos ya no tienen que estar pagando altos costos fuera, sino que aquí mismo se les resuelve y eso les da más, como se sienten mejor, ¿verdad? Se sienten que ellos están más atendidos. También tenemos otro programa donde se les da charlas de psicología y esto para mí es bien importante porque les ayuda a comprender a ellos todos los cambios físicos que se van dando en la medida que van pasando los años, ¿verdad? Entonces hay cambios que se generan, que a veces se le olvidan las cosas y entonces hay ejercicios también para mantener activa la mente. Uno puede ver cómo ellos van evolucionando, ¿verdad? Al principio aquí la gente no se conocía unos con otros, entonces en la medida que han ido participando en las actividades, en las reuniones, se van haciendo de amigos y así ellos tienen a quien visitar, a quien llamar, se comunican por teléfono y ahí están, hay una interacción más fluida. Y siento un gran cambio Entonces, en el estado anímico de ellas, porque hay gente que como con el paso del tiempo, con las edades, van como perdiendo ese, ¿verdad? El espíritu de que ya me siento viejo, o sea, van perdiendo esa frustración. Entonces ahora lo veo yo más ánimo, ¿verdad? Con más, ¿cómo se llama? Más solvencia de participar, y el estado anímico cambia un gran montón. En la medida que ellos adquieren esa capacidad, entonces también ayuda a socializar, a visitar los amigos, a compartir. Y yo he sentido que hasta incluso para ir a una tienda a compras, entonces hay un desenvolvimiento mayor. La jardinería es bien importante por el contacto con la naturaleza, pero también estar en contacto y aprendiendo cómo se siembra una semilla, cómo va surgiendo la plantita, o cómo siembra una plantita y después ver los tomates, ver los chiles. Eso les motiva también, y les da un sentido a la vida, ¿verdad? De que hay algo que hacer, que no solo estar sentado viendo televisión, y entonces hay como una variedad del quehacer en la vida. Así es que veo eso como muy importante.
So thanks to all the panelists and wonderful presentations. As we close the panel session, I would like to start with our question and answer session. And we have a question, and it's can be for anyone, for Rosa, Manuel, and Anna as well. So the first one is, does artificial intelligence have a role in addressing loneliness among older adults?
Okay, I'm unmuted now. Artificial intelligence is a complicated subject. I think the main thing we need to do, yes, I'm sure it can play a role, because we've seen amazing progress when it comes to technology, when it comes to innovation, especially in the realm of artificial intelligence. However, we need to ensure that these new technologies are developed responsibly, right? And we need to ensure that we educate everyone in our communities about what does it even mean? What does artificial intelligence means? Who's producing it? Who is it benefiting? How does it impact us, right? So I think that's the most important thing we need to do. We need to understand these new innovations, these new technologies, and what role they play in our communities, in our lives. Innovation is great, technology is great. I love it, I benefit from it. But I do have a love-hate relationship with it, right? Because if it's not developed responsibly, it can have a negative impact in our communities. So we need, in my view, in my opinion, the most important thing we can do is educate ourselves about what this means and how this impacts us. Latinos, for example, I'll speak about young Latinos and then connect it to the older community. But Latinos, for example, are not necessarily going into the STEM fields the way they should be doing it, right? And we need to encourage that our young folks are going to the STEM fields, are understanding how this impacts us. I mentioned earlier during my presentation that it is important to have that community support for older adults. For example, having a program where young adults help the older adult community about how to use technology, about how to understand these issues and how these issues them. But again, when it comes to artificial intelligence, yes, absolutely it can help. But again, do we know how it's being developed, who's developing it, how it impacts us? No, we don't have the details, and we need to. I understand that these conversations can be a little intimidating for some folks, and they are for me as well, right, when it comes to technology, because we are barely at the beginning of innovation. Since the inception of the iPhone until now, there has been so much progress. Hundreds of thousands of apps that have been developed in the last 15, 20 years, in the last 10 years as we speak. They're being developed as we speak. So technology is moving really, 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 really fast. But us, the way we are educating ourselves and the way we are educating our communities about these issues, we're not doing it as fast as the way innovation is moving, and we need to, in order for us to not only protect ourselves from the negative impacts, but also to be able to benefit from the positive impacts of technology.
Thank you, Rosa. Manuel, you want to say something?
Yeah, I would say about that. And I'm an engineer myself, and I use artificial intelligence to write code, to prepare the technology. But the most important thing is that we need to understand that technology is here to serve the humans, right? And I got into technology because I wanted to support my mom, and I don't want a robot calling my mom. You see what I'm saying? There's plenty of other older adults. What we promote is to have older adults that care about each other, and there is nothing that can care about each other more than a human. So we don't need to sit and wait for artificial intelligence to come and solve the problem. That's going the wrong way. In my opinion, what we need to do is do webinars like we're doing today, inviting older adults that there is a better life out there. If they get out of the house, if they go start talking to other people, if starts setting up a project to help each other, to be there for one another, that's a lot more important than technology. And I use a lot of technology because we send emails for reminders. We make it easier to do the mailing list for the newsletter because it writes beautifully in English, better than I can speak English. So we need to use technology when it serves us. But having the social connection and the human connection is better than artificial intelligence. So don't wait for it. Let artificial intelligence do what they do best, which is make things automatic. But let's have human connection as something that is more important than technology, and we just need to put our priorities in the right way.
I would add to what Manuel mentioned, if you don't mind. Manuel, I fully agree with you. I think there's nothing better than a one-on-one connection, in-person connection, right? But for those older adults that are not able to do that, right? Some due to physical challenges, due to the fact that they live in communities where these services are not provided, then they should be encouraged to use technology. Because technology, it brings a lot of benefits, and it helps those that are not able to participate in in-person events or in-person trainings like the ones you're mentioning. So technology is beneficial, is very important, and we need to fully understand it as well in order for us to be able to use it correctly and to benefit from it.
Yeah.
So that leads me to go ahead, man.
No, just so absolutely. I mean, I run a technology company. So, but the thing is, technology needs to be there to help humans do what they want to do. See what I'm saying? The goal is not having the technology. The goal is to have this human connection. If the human connection is not possible because a person is homebound, well, then we'll have that person on Zoom using some technology. But technology is not the goal. Technology is a tool.
Absolutely. So that leads me to the final question, that is, how can we engage seniors into technology? What do you suggest?
What was the question again?
Yes, what can we do to engage seniors into technology and using technology?
I think I mentioned some of those points in my presentation, and one of the main things that we can do is, again, teach them how to use it, right? Because unfortunately, if you look at the statistics about scams, the folks that are scammed the most are older adults or people that don't speak English, excuse me, as their first language, right? Because it's easier for scammers to fool them, right? So it's important that we teach, our grandparents or the older adults in our communities that they need to be careful when they go online, right? Like, don't put your social security on any website just because they ask you for it, right? So be careful with when you provide personal information. And if possible, if you have family members in your household that can help you navigate, if you need to get a service online, right? You need to visit your doctor, for example. If you can have a family member help you navigate that process, then great. If you're not able to, then again, at least teach them to be vigilant and careful so that they don't, face scammers online and get their information stolen, their identity stolen, or, money stolen, whatever it is, right? Depending on what website they visit. I think we also need more programs as the one I mentioned, programs that can connect older adults with young adults, right? So that they can teach him how to use social media, for example. For those Latinos that have family members in other countries, they can stay in touch with their family members via social media, right? So just teaching them to be comfortable using online platforms and just getting online in general, I think is very, very important, because it's a very intimidating, world, depending on what interface you use, depending on what website you go to, right? It can be intimidating. And again, especially for older adults, because they're not digital natives. They didn't grow up with an iPhone, right? They grew up with technology that was very, very different, if they grew up with technology at all. That it was very different than what we use now. So it's important that we make them comfortable with new technology, right? And it's important that, again, we advocate to ensure that the technology that is being developed, that is not only developed responsibly, that is developed in a way that is age appropriate, in a way that is age inclusive, right? That we take in consideration the nuances of older adults and the challenges that they face when these technologies are being developed, to ensure that every interface that is being used, that is user friendly, so that it's clear that I need to push this button and it takes me to wherever I need to go, right? Without having to be a techie for you to be able to use those technologies.
Thank you,
Yeah.
Rosa.
I would add my 2 cents. Obviously, training is very important, but in my opinion, rather than having a project to push technology onto older adults as a goal, in my opinion, what is best is listening to the older adults about what do they want to get done. For example, in the case of my mom, right, she would say, well, I go to yoga classes on Mondays. The rest of the week feels kind of lonely. Well, I'm listening to her and saying, okay, well, you know what? Look at this website, right? And here you see that there's yoga on Mondays, but there is other activities on Tuesdays, Wednesday, Friday. If you look at it, and then if you click on that event, it will offer you the possibility to register, add your name, your email. You click, I sign up for this event on your iPad, and then that's it. You're registered. But basically, here is like, we're not just trying how to use any technology in all circumstances, but just listening to what are the needs of the older adults. You want to go to that event, so you're feeling lonely and you like your yoga class. Guess what? There is a book club event on Friday. You can go to it, and it's easy to do it if you just learn how to go to this calendar of events, click on it, add your first name, last name, email, and sign up for it. Obviously, there are several conditions. Part of it is the training. Rosa, as you were saying, I'm training my mom how to use the iPad to go to that event. Another key component is that technology, rather than having older adults adapting to technology, right? Like we pushed a lot of older adults to learn about Facebook, but Facebook was designed for college kids, right? It should work the other way around. Technology should be designed for older adults. When we built Helpful Village, my goal was removing buttons from the interface. How can I make this easier if we don't need all these other 25 options about a marketplace or all of that? Just my calendar of events is just one button that says register for this event. So if we make first, listen to the older adults about what they want and what do they want to get done. If we make the technology easy for them to use, and third, as Rosa said, provide the training so that they can accomplish that task, then they love technology.
And I get it. I think we all have different views as far as what we're discussing. So I get it. Nothing beats in-person interactions. Nothing. When COVID happened, everybody did, Zoom events, right? Events like this one. And when it came to the network component of it, I thought that was useless, because you can't really network in a platform like this, right? We can have these type of conversations, and this is amazing, but you can't really network, because networking is more of an in-person activity. However, again, sure, if every older adult had the services that you're mentioning, Manuel, then we wouldn't have an issue, or we wouldn't even be having this conversation. The problem is that they don't. Right? So what do we do with the adults that don't have the services you are talking about? What do we do with the adults that live in communities that don't provide those services? Then yes, we do need to push technology, because technology can help with social isolation. But again, I agree with you. It would be amazing if all adults lived in communities where these services are provided. But when they don't, what do? You do have to rely on technology. You should rely on technology. Or sure, go in that community and provide those programs. But again, when they don't exist, technology can help those adults that don't have other options, right? So I think it is important.
Yes, and before concluding, as you mentioned, it's good to teach older adults. I think you mentioned a good component, that is family, or those that are friends or neighbors that can actually help those seniors to navigate Zoom or do FaceTime. And again, it's all teamwork. So again, thank you to our sponsors, speakers, and attendees for joining us for today's virtual event. We encourage again all of you to follow us in our social media channels as X, Facebook, Instagram, and YouTube as at NHCOA for more information about upcoming events. And let's all continue to advocate for programs and resources to better support older adults and their caregivers. So until the next one, thank you again, Manuel, Ana, and Rosa, and Dr. Cruz. Thank you. Gracias.
Gracias.
Bye-bye.
Thank you, everyone.
Bye.